Silent kidney failure, early signs, and how to protect yourself. Kidney failure doesn't cause obvious pain, but it silently impairs health and daily activities. Many people only realize it when their bodies are already fatigued, swollen, and lacking energy. Welcome to the Senior Health Channel. This video will help you recognize early signs and protect your kidneys properly. What is kidney failure? Kidney failure is a condition where the kidneys are no longer able to filter blood, remove waste products, and balance water and electrolytes in the body. The disease can occur acutely, rapid progression, reversible with early treatment, or chronically, long-lasting, progressively worsening, and irreversible. Chronic kidney disease is divided into 5 stages, including stages 1 to 2, almost no symptoms; stages 3 to 4, onset of fatigue, edema, metabolic disorders; stage 5, end-stage renal failure, requiring dialysis or kidney transplantation. Signs of kidney failure. Why are they easily overlooked? Kidney failure may have no obvious symptoms for a long time. Some common signs: decreased urine output, swelling of the ankles and feet, unexplained shortness of breath, fatigue, drowsiness, lethargy, poor appetite, nausea, vomiting, itching, muscle cramps, weight loss. More severe cases may include seizures and coma. Common misconception: I'm just tired. Because of age. Causes of kidney failure. 3 main mechanisms. 1. Reduced blood flow to the kidneys, due to heart disease, liver failure, severe burns, sepsis, abuse of blood pressure, and anti-inflammatory drugs. The kidneys are lacking blood supply, leading to damage to kidney cells. 2. Urinary tract obstruction. When urine cannot drain, toxins accumulate, pressure builds up on the kidneys. Common causes: kidney stones, enlarged prostate gland, bladder, colon, and cervical cancer. Bladder nerve damage. 3. Direct kidney damage, including glomerulonephritis, lupus, heavy metal, poisoning, uncontrolled diabetes. Side effects of cancer treatment drugs and contrast agents. Age-related kidney aging. This is the most common group of causes in the elderly. Kidney failure doesn't just require dialysis. It leads to a series of dangerous complications: anemia, osteoporosis, phosphorus disorders, hyperkalemia, risk of cardiac arrest, cardiovascular disease, fluid retention in the body, psychological disorders, depression. Dialysis does not completely replace the function of the kidneys. To determine the cause and extent of the disease, the doctor may order kidney ultrasound to assess size and structure, CT, MRI to detect obstructions, tumors, and lesions, renal scintigraphy to assess filtration and excretion function, kidney biopsy to identify kidney tissue pathology. When needed, the earlier it is detected, the wider the treatment options. Kidney failure cannot be completely cured, but it is entirely manageable, and a quality of life can be achieved with proper treatment. Treatment methods for kidney failure. 1. Medical treatment. Preserving the remaining kidney, prolonging healthy life. The nature of medical treatment does not cure damaged kidneys. Main goals: controlling symptoms, reducing the burden on the kidneys, slowing the rate of kidney failure. Medical treatment equals preserving remaining kidney function. Which stages is it applied to? Kidney failure stages 1 to 3. Some cases of stage 4 if well responded. If done well, patients can delay dialysis for many years. What does medical treatment include? Blood pressure control. Goal: reduce pressure on the glomeruli. Medications help reduce protein leakage, protect kidney structure. The more stable the blood pressure, the better the kidneys breathe. Blood sugar control. Avoid blood sugar fluctuations. Prevent damage to renal microvessels. Stable blood sugar equals slow glomerular sclerosis. Dietary adjustment. Reduce protein, reduce waste products. Reduce salt, reduce edema. Lower blood pressure. Control potassium and phosphorus. Eating properly can save the kidneys a lot of effort. Treatment of complications. Anemia. calcium phosphorus disorders, edema, metabolic, acidosis. Common mistakes. Thinking that taking medication is enough, not attending regular checkups, self-medicating with herbal remedies or folk remedies. Medical treatment is only effective with high discipline. 2. Artificial kidney dialysis. Artificial kidney dialysis. Partial replacement of kidney function with machinery. Nature. Blood is removed from the body, passing through a filter. Membrane. Removes urea, creatinine, excess fluid. Clean blood is returned to the body. Does not cure the kidney, only helps prolong life. When is it applied? End-stage renal failure. Filtering function, 10 to 15%. Severe symptoms, significant edema, short breath, urea toxicity. Procedure, free times/week, 3 to 5 hours each time. Lifelong, if no kidney transplant. Advantages, common, rapid toxin control, suitable for many patients. Limitations, machine dependent, fatigue after each dialysis session. Risks, hypotension, vascular infection, cardiovascular disorders. Dialysis helps with survival, but significantly reduces quality of life. Free, peritoneal dialysis, blood filtration using the body's own peritoneum. Nature uses the peritoneum as a natural filter. Dialysis fluid is introduced into the abdominal cavity. Wastewater diffuses through the peritoneum. Then the fluid is discharged. Who is it suitable for? Individuals who are still able to care for themselves, have a good hygienic environment, do not want to be dependent on hospitals. Advantages, do it at home, less fluctuation in blood pressure, easy to maintain normal daily activities, suitable for the elderly and children. Disadvantages, risk of peritonitis, requires strict hygiene practices, not suitable for people with severe obesity, multiple abdominal surgeries. Peripheral dialysis equals more freedom, but high discipline is required. 4. Kidney transplantation, the best solution currently available. Nature, replacing a damaged kidney with a healthy kidney. The new kidney performs almost all physiological functions. Greatest benefits, no need for dialysis. Significant improvements in lifespan, quality of life, work capacity. Successful kidney transplants can result in healthy lives for decades. Conditions and challenges, suitable kidney donor, major surgery, lifelong, immunosuppressant medication required. Risks, infection, rejection, drug side effects. Kidney transplantation is a life-changing process, but it's not the end of the road. Red circle quick comparison of 4 methods. Method goal quality of life. Medical treatment slows kidney failure high if disciplined. Dialysis maintains life moderate. Peripheral hemodialysis maintains inflexibility fair. Kidney transplantation near normal recovery highest. Kidney failure doesn't have just one path. Early detection and the right stage are crucial. Proper treatment. You can live longer. You can live a better quality life. You can take control of your life. 8 most important things to do to prevent kidney failure. 1. Control diabetes and blood pressure well. The #1 cause of kidney failure worldwide. Why is it extremely dangerous? High blood sugar damages the tiny capillaries in the glomeruli. High blood pressure puts constant pressure on the kidney's filtering system. The kidneys are worn down day by day with no early symptoms. Common mistakes. I still urinate normally, my kidneys must be fine. The numbers are a little high, no need to worry yet. Slightly elevated but prolonged levels equals silent kidney damage. What to do to prevent it? 1. Monitor blood sugar and blood pressure regularly. Don't stop taking medication when you feel good. Maintain a stable diet and avoid large fluctuations in blood sugar. Controlling these 2 factors well can reduce the risk of kidney failure by more than 50%. 2. Avoid overuse of over-the-counter medications. Painkillers are the silent killers of the kidneys. Little-known facts. Many painkillers and anti-inflammatory drugs inhibit blood flow to the kidneys. Prolonged use kidney oxygen deprivation micronecrosis. Who is most susceptible? Elderly people, people with joint pain, chronic headaches, people who have been self-medicating for many years. Danger signs: persistent fatigue, mild swelling in the legs, gradually decreased urine output. Not all over-the-counter medications are safe for the kidneys. 3. Maintain a healthy weight. Obesity equals kidneys working overtime 24/7. Mechanism of kidney damage: overweight, increased insulin resistance, increased chronic inflammation, increased blood pressure and blood lipids. Kidneys have to filter more than normal for a long time. Exhaustion sooner than expected. Benefits of weight loss: reduced glomerular filtration pressure, improved blood pressure and blood sugar. Significantly slows the progression of kidney failure. Just losing 5 to 10% of body weight is beneficial for the kidneys. 4. Eat a low-salt diet. Salt is a fastener of kidney failure that many people overlook. What happens when you eat salty food? High blood pressure, water retention, makes kidneys filter more sodium. Where's the hidden salt? Fish sauce, soy sauce, pickled foods, processed foods, instant noodles, canned goods. It's not just about reducing salt in the kitchen, but reducing salt in the entire diet. 5. Drink enough water. Water is the lifeline of the kidneys. When dehydrated, urine becomes more concentrated. Waste products accumulate longer in the kidneys. Increased risk of kidney stones and renal tubular damage. But how to drink correctly? Drink regularly throughout the day. Don't wait until you're thirsty to drink. Avoid drinking too much at once. Water helps the kidneys flush out toxins every day. 6. Limit alcohol. Alcohol dehydrates the kidneys and increases toxins in the blood. Dangerous double impact. Causes dehydration. Kidneys work harder, increases blood pressure, causes inflammation and oxidative stress. Regular drinking, even without getting drunk, still causes long-term harm to the kidneys. 7. Don't smoke. Smoking accelerates kidney aging by many years. Mechanism of kidney damage: vasoconstriction, reduced blood flow to the kidneys, increased inflammation, accelerated glomerular fibrosis. Smokers have a significantly higher risk of kidney failure compared to non-smokers. 8. Exercise regularly, reduce stress. Kidneys also fear stress. What does prolonged stress cause? Increased cortisol, increased blood pressure, metabolic disorders. Benefits of exercise: improved blood circulation, stabilized blood sugar, reduced inflammation, better sleep, better kidney recovery. No need for strenuous exercise. Consistency is key. Kidney health doesn't deteriorate overnight and cannot be protected by a single habit. The most important thing is to understand early, adjust early, maintain consistency. Every small choice today will determine your long-term quality of life. Taking good care of your kidneys not only helps your body stay healthier, but also helps you live more actively, peacefully, and with greater peace of mind each day. Thank you for watching the video to the end. If you found this content helpful, please like, share it with your loved ones, and subscribe to the Senior Health channel so you don't miss the next videos. Wishing you good health and peace, and see you in the next video.